This video will discuss stress management. Stress management starts with our body, as our bodies hold the score of stress. We need to understand the biology of what is happening to us when we are experiencing stress. Stress and the body. Our nervous system is divided into the central nervous system, the brain, the spine, and the peripheral nervous system, which we will call the PNS. The PNS is made of the autonomic nervous system, which we will call the ANS, and the enteric nervous system, which is in our gut and sometimes called the little brain. These are in constant communication with each other through chemicals like hormones and neurotransmitters, sending information back and forth about how the body is functioning and what is happening. Our ANS is a control system. It acts mainly unconsciously and regulates our body functions like heart rate, digestion, respiratory rate, urination, and sexual arousal. Our breathing is the only function of the ANS we have conscious control over. It has two parallel sets of nervous systems that work together in balance. These are the parasympathetic and the sympathetic systems. Both directly communicate with and affect the functioning of the central and enteric nervous systems. Usually these two systems are in balance. The parasympathetic nervous system helps us rest and digest. It's responsible for managing lots of body processes that help us feel calm and at ease. This system is active when our brain tells us that everything's going well, no emergencies need attending to, and we can devote our time and attention to eating, digesting, sleeping, and generally hanging around and feeling relaxed. The sympathetic nervous system helps us to take action when we need to because of some kind of stressor, threat, or danger. Our body responds with the adrenaline response, releasing the hormone cortisol. This is often called the fight, flight, freeze, flop, or faint response. This system is active when our brain tells us there is something that needs to be dealt with, like a stress or threat of some kind. Some common physical symptoms of stress can include an increased heart rate, shallow and fast breathing, nausea and diarrhea, sweating, pins and needles, aches and pains, sensations of butterflies in your stomach, blurred vision, headaches and tension, colds and infections, tiredness, poor concentration and memory, a dry mouth, feeling you can't think straight, heartburn, and abdominal pain. There are also emotional symptoms of stress. These include feeling weepy, moody, and sad, feeling out of control, frustration, feelings of isolation, nervousness, feeling snappy, and feeling lonely. Some behavioural symptoms of stress can include low motivation, restlessness, an increased or decreased appetite. You may smoke, drink, or eat more. Agitation, sleep disturbance, a change to your libido, obsessive behaviours, avoidance behaviours, negative thoughts or worry, and self-neglect. The immune system and stress. Stress in short bursts can be helpful and motivating. When we face a longer-term situation, the stress response can be less helpful. Stress in a situation that is ongoing, uncertain, unpredictable, and outside of our control can mean stress adds to the situation, making us feel worse, not better. It is understandable why we experience the arousal response. It is our body's way of trying to get us out of a situation if we can. When the threat remains or is in the future, We can't fight or flight or run away from it, so we get caught in a cycle of sympathetic arousal, with stress, worry, tension, and secondary physical symptoms like gut upsets, headaches, aches and pains, and so on. Long-term stresses suppress the immune system from working optimally. We may get tension, headaches, aches and pains, and difficulty sleeping. When we are under stress, it reduces the immune system's ability to fight off antigens because it reduces our white cell numbers. This leads us to being more susceptible to infections. Short-term suppression of the immune system is not dangerous, but we all want our immune systems working optimally right now. There are things we can do to reduce stress that will boost our immune system. Reducing stress and keeping the immune system fighting fit. Activities that switch on the rest and digest parasympathetic system are important to manage stress, reduce tension and worry, and also bring the ANS back into balance. These include progressive muscle relaxation, worry time periods and refocusing attention on a task, techniques to manage uncertainty and refocusing on a task, mindfulness, relaxation, sleep hygiene, and keeping in a routine. Breathing, stress and anxiety. We have two different types of breathing. Most people, when asked to take a deep breath, raise their shoulders upwards and their chest expands. This is chest breathing. When we are asleep, we don't chest breathe, we deep breathe. Most of the time, we deep breathe when we are not consciously paying attention to the breathing. Deep breathing can reduce stress, and there is a good evidence base that supports this. Chest breathing, however, switches on the arousal response, which is not what you want when you want to relax. Equally, when you ask people to focus on their breathing and breathe deeply, people take in a sharp inhale of breath and chest breathe instead. When we feel anxious and breathing increases to take in more oxygen, people focus on their breathing and often breathe more shallowly and faster, which then works against the body trying to take in more oxygen, and it can lead to hyperventilation and induce panic. Deep breathing for stress management. For general stress management, deep breathing can be helpful in those without an anxiety disorder. True deep breathing can switch on the rest and digest system. To use it, it requires practice at neutral times, once or twice a day. 1 to 2 minutes is enough time. You can use it when stressed just for 30 seconds, and it can be enough to switch on the rest and digest system. So how do you do it properly for stress reduction? Get comfortable. Some people find it easier when lying down. Then put one hand on your chest and the other hand on your stomach, just below your belly button. Inhale by keeping your tummy muscles tight, in through the nose for about 5 to 6 seconds. As you breathe in, feel your stomach rise, and as you breathe out, feel your stomach lower. Exhale for longer than you inhale, slowly and in a sustained way for 8 to 10 seconds. Imagine you're trying to blow out lots of candles. It can help to hold a finger up about a foot away from your face and tighten your stomach and blow a blast of air at your finger so you can feel it on it. This will give you a respiration rate between 4 and 6 breaths per minute. You only need to practice for about 1 to 2 minutes. Then, if you need it, use it at other times for about 30 seconds, just 2 or 3 deep breaths. Remember though, that COVID-19 can affect breathing ability to deep breathe, so we wouldn't advise it for anyone with symptoms. Progressive muscle relaxation is an exercise to reduce stress and anxiety in your body. For a step-to-step guide, you may find it useful to look this up online for a tutorial on how to do this. Grounding techniques can also help you keep connected to the present and help you manage strong feelings, dissociation or intrusive thoughts. You could try engaging your senses into a powerful way to soothe you. Focus on the sensations you are feeling. You might find it helpful to keep a box of things with different textures or smells. For example, perfume, a blanket, and some smooth stones ready for when you need it. These are just some grounding techniques you can use. Open your eyes. Put your feet on the floor. Uncover your ears. Name 5 things you can see. Name 4 things you can hear. Name 3 things you can smell. And touch a variety of textures and fabrics. Take several deep breaths. Exhale longer than you inhale. Disengage from staring off or focusing too intently on one object or area for too long. Vocalize. Turn on some music. Splash your face or run your hands under cold water, or even hold cold water in your mouth. Chew mint or cinnamon gum. Suck on mints or sour sweets, or anything really with a really intense taste and smell. Repeat a calming mantra to yourself. Use internal communication. Remind yourself you're safe and you're okay, just upset or experiencing symptoms right now. Call up a friend or a safe person to talk to. If you're lying in bed, sit up. Journal. Write down what's happening, particularly if it's upsetting. Write a note to someone, or even yourself. Play calming apps on your games or your phone or tablet. Stretch. Open up your body so wide and press your feet firmly into the ground. Orient yourself to your body from the top of your head to the tip of your toes. Try dancing. Try some brain puzzles that require problem solving. Pet animals. Change your scenery. And take time to laugh. These are just a select few of the grounding techniques you can use to help deal with stress and help you live more presently. Remember to look after yourself in these stressful times, and remember to take each day as it comes. Thank you for watching, and I hope this video has been useful to you.